My name is Sophie Witter. I'm a Professor of International Health Financing and Health Systems Research based at Queen Margaret University in Edinburgh. For this work we were commissioned by DFID to look at what works for health system strengthening and in what situations. And it was a piece of work which we did with colleagues from Liverpool School of Tropical Medicine and also London School of Hygiene and Tropical Medicine, and the review was conducted between October and January of this year. One of the first things we did was to have to try and develop a kind of typology. So what is health system strengthening? What are the different categories? And one of the advantages of this is that it allows you to identify gaps in the evidence. And so one of the things we found was that there is in fact quite a concentrated literature in some areas, for example service delivery and the health workforce, there was a lot, and other areas which we know are really important like health information systems and supply chain management, in fact relatively few studies in the published literature. And we think that's because these are seen as more operational topics, so potentially there's a lot of grey literature, but nevertheless in terms of knowing what works, that's a gap that we need to fill. We looked at areas that have stronger evidence base, and we found, for example, that complex whole system reforms, there's quite a lot of evidence that those produce good outcomes. Also, for example, in relation to governance areas like leadership development and mentoring, there's good evidence base for that. Also, in relation to the health workforce, having bundled retention packages which address different facets of health workers' needs, for example, financial, non-financial, and educational, those can be effective in terms of different types of outcomes. For health financing, what we concluded is that certainly there's good evidence for aggregate spend increase, public spend, as opposed to private in terms of both equity and health gains. But for many of the health financing instruments, there's quite mixed evidence. In other words, they can work, it depends really how they're done and the extent to which they improve the underlying health financing function. We found that there are a number of interventions around integrated packages of care, particularly for mother and child health, but also IMCI and community engagement interventions where really you have quite a decent evidence base. But of course, the fact that there isn't evidence that something works doesn't mean it doesn't work. It sometimes just means we haven't got enough studies to look at it properly. Often when for example, governments or donors invest in something like health workforce, they will only measure the effects on specific indicators related to the health workforce. And yet what they're doing often has systemic effects. So we need to be using evaluation frameworks which pick up those wider effects, which recognise that those really matter. Ultimately, everything connects in a health system. So if we're only measuring one part of it, we're missing the big story often. And so one of the things we've done as part of this evidence review is to start to develop a framework which tries to look at what are the indicators of a strong system. And we hope that's a framework which will be used and tested and developed further and try to broaden the way that we study these interventions. One of them that we raise is about having a better consensus on a definition for health system strengthening. So how do we know what to include in that concept? And we've proposed a definition which focuses on 4 elements. One of them is around scales. Does an intervention have a national reach, for example? Does it cover different levels of the health system? But also, in terms of scope, it's very important to think about whether it crosses different building blocks, it has kind of spillover effects, but also whether it impacts on different disease and care groups. A third aspect which we think is really important is around sustainability. So does it address systemic blockages and have potential effects that last over time. And the final question is, of course, around the outcomes, which you can't always measure immediately, but clearly we want to achieve goals of health improvement and better financial risk protection, for example. So we think all those elements should be within a definition of what is a health system strengthening intervention. We also think it's really important to look not just at the design of the intervention, but understanding across the whole spectrum, what is it that really supports effective implementation and good results. And there are a number of things that came out of our review in relation to that. So for example, coherent design of packages, sustained political commitment. We've talked about community engagement as being a factor which is likely to increase success, whatever the intervention. But equally, leadership development and mentoring. Understanding these factors for success is a really important message, I think, for funders and implementers. Another message I think I would like to bring out from the review is around the kind of questions we ask about health system research. I think it's really important not to ask questions around, for example, does an intervention work in a sort of simple way, because the answers are more complex. So to use an example that I've worked on a lot in performance-based financing, whether performance-based financing works in a given context is really related to a very complex set of factors around the starting position of the health system, how health workers are being paid, how finance is flowing, how health workers are motivated, for example. And all of these will affect it. Plus the designs are very varied, the way in which they're implemented is very varied, the feedback loops, the process of adaptation, all of these affect how well the intervention will work. And therefore the question is not, does performance-based financing as such work? It's more understanding the conditions and the type of context in which certain mechanisms can be triggered. And I think our framework tries to pick out those mechanisms and tries to relate those to the strong health systems that we want to achieve. I hope that the review has made the case for the health system as an essential platform from which all healthcare maintenance and prevention activities occur. And it's really important that those platforms are able to manage complexity and able to learn. And so health system research is an essential component within that learning health system that allows for a feedback of evidence for adaptation, for iteration and for change. So we know the world is a fast changing place, we know it's very complex and it's really hard to model exactly how things will work out in advance. So what we need is intelligent feedback mechanisms, and health system research is really that, both on a local, national and a global scale. And we hope that DFID and other donors will really continue to support this area, because we live in a world where increasingly there's a lot of focus on specific goals, specific interests, and actually investing in and supporting that platform which allows for real national ownership and a real organic development of a strong health system is absolutely essential.